Can aggression be rewarded? Unfortunately, yes. If, for example, a child who pushes and hits his peers gets the desired object without being punished or noticed, and or a child gets a desired object by pushing a peer, for instance. What is preventive parental intervention? Some of the risk factors for child disorders, for example, disruptive behavior disorders, are maternal antisocial behavior, relatively young age of the mother when she had her first child, smoking during pregnancy, maternal depression shortly after the child's birth, and hostile parental practices. Physical aggression can also be predicted by low income, low maternal education, family dysfunction, and the presence of the young siblings. After identifying the risk factors, a series of intervention procedures should be conducted, including prevention of smoking, drug and alcohol use, prevention of childbearing at a young age, home visiting during pregnancy, and enhancing parenting. Home visiting aims to improve maternal health-related behaviors during pregnancy, for example, nutrition, use of cigarettes, alcohol, or illegal drugs, to increase the mother's social support and use of community resources. Foster sensitive parenting behavior and support the mother in making decisions likely to affect her future course, for example, subsequent pregnancies, education, and work. Parent training programs that include group discussions and problem solving around the program objectives, for example, using praise and rewards, setting appropriate limits, and managing misbehavior can be of great help to inexperienced parents. How can aggression be prevented? A child's aggressive urges can be redirected toward positive outlets. Active running, jumping, expressive art activities are strategies that may help children get out their aggressive urges. Also, aggression can be prevented through modeling non-aggressive social problem solving, rewarding children for using appropriate behaviors, limiting and thorough selection of media, encouraging children to express anger or upset through positive outlets such as art or music, talking to children about the consequences of their expressive acts. How is a caregiver, teacher, expected to react to aggressive behaviors? I would like to mention new chapter 33. It's a rule governing physical restraint and seclusion. It was recently developed in response to some parents of special education students who filed complaints regarding the safety of prone restraint. New Chapter 33 replaced the old one and became effective in July 1st, 2012. All covered entities, schools, and educational programs shall revise existing policies and develop policies consistent with this rule within 90 calendar days of the effective date of this rule. Our preschool is in the process of devising our own local policy, and basically we have another month to complete it. I'm personally very careful about the use of physical restraint, that is physical escort, physical prompt, physical contact. Those who work with students with special needs know sometimes you have to use physical restraint for the child's safety, especially in one-on-one settings. It's also not clear if we are allowed to hold the child by putting arms around the child to calm him down, basically until it feels comforting. We all know it works when a child has a meltdown. So there is some confusion between the teachers, especially those who have children with aggressive behaviors in their classrooms. I feel like even though the rule is detailed, it's on 13 pages, it doesn't make the procedures clear and helpful in situations when the teacher has to apply physical restraint or seclusion. Now, teachers have to use their own judgments when assessing the situation. For example, when a child is damaging the school property, we are prohibited to use physical restraint. But do we know if the child can do harm to another child? The new law is part of the general education law and therefore applies to all students. It does not allow a student to be physically moved unwillingly. If a child is out of control, the directive is to evacuate the classroom. Prohibited uses of seclusion. It is prohibited to use seclusion for punitive purposes, staff convenience, or to control challenging behavior. It is prohibited to use seclusion to prevent property destruction or disruption of the environment, as a therapeutic or educational intervention, and it may not take place in a locked room. A seclusion room must be a minimum of 60 square feet with adequate light, heat, ventilation, be of normal room height, contain an unbreakable observation window in a wall or door, and be free of hazardous material and objects with which a student could self-inflict bodily injury. It is prohibited to use any forms of physical restraint that restricts the free movement of the diaphragm or chest, or that restricts the airway, that relies on pain for control. These are just some of the forms that are prohibited. Among others are aversive procedures and mechanical and chemical restraints. A student in seclusion must be monitored by staff certified in a state-approved training program. At least one adult must monitor a student while not present in the room. If it continues for more than 10 minutes, an administrator shall determine whether the seclusion is warranted. If attempts to release from seclusion have been unsuccessful and the student is still presenting behaviors that create an imminent risk, then outside sources such as caregivers, case managers, crisis intervention teams, or other community resources could be requested to assist. What else does the rule set forth? Required notification of an incident, required documentation of an incident, response to multiple incidents, local and state complaint processes, department approval of training programs. Besides reporting to an administrator, the student's parents must be notified within the school day in which the incident occurred. Each use of physical restraint or seclusion must be documented in a detailed incident report. Its copy must be provided to the parents within 7 calendar days. For my PowerPoint presentation, I used the website which describes Chapter 33, the new rule governing physical restraint and seclusion, 2 textbooks by Hooper, Umansky, and Travis Smith, and a few articles from peer-reviewed journals. Thank you.